Hello, today we will be talking about the lateral elbow and how to position our patient for the image when exposing. First, we will need to do a couple of things. First will be patient preparation. We will need to ask our patient for their full name, date of birth, and LMP, or last menstrual period if needed. We will also need, for our image receptor size, a 10 by 12 cassette. Our cassette will be placed in portrait orientation to further help us with this image. The image receptor location the cassette will be placed tabletop with the patient elbow centered in the middle, as well as with the hand lateral to the cassette. We will need to position the hand and wrist in true lateral position with a thumb side up. Our SID for this image will be 40 inches from the image receptor. Our patient positioning. Our patient will be seated at the end of the table, facing forward with the elbow flexed at 90 degrees. Our patient will also have a shield placed on them and held by their free hand in order to protect their gonads. Part position. The part position is aligning the forearm to ensure that the shoulder, humerus, and forearm are all on the same plane. This will make us want to have our medial and lateral epicondyles in our elbow to be superimposed to give us the best image possible when doing a lateral elbow. If all three parts, the shoulder, humerus, and forearm, are not on the same plane, we will need to adjust and use sponges or anything else we have disposable to us to ensure that all three are on the same plane. The central relocation is directed around mid-elbow joint, approximately 1.5 inches medial of the epicondyles and posterior surface of the olecranon process. Our central angulation will be perpendicular to the image receptor. Our collimation field size will include the collimation on all four sides of interest being of equal size. The visual of appropriate marker location will be anywhere in the collimation field, so long as it does not obscure the image and it can be placed on the medial or lateral side of the forearm. Instructions to the patient for exposure. We will inform the patient that they just need to hold still and do not move. They can keep breathing normally and do not need to hold their breath for the image exposure. The anatomy demonstrated will include the lateral projection of the distal humerus and the proximal forearm. This will include the humerus, the radius, and the ulna. Items in profile will include the olecranon process, the 3 concentric arcs visible, soft tissues, and fat pads of the elbow joints. Pathology best demonstrated through this image are certain joint pathological processes that can be seen and dependent on the 90-degree flexation. With doing all of this, we will help assist us to be able to get the best lateral image for our patients. Thank you.